Hi, Dr. John Torres here on my Daily Doc, where a couple times a week I go over coronavirus headlines, health-related headlines, and get you some information behind those headlines so you have a better understanding of what that means to you. And particularly with the news these last few days, these last few weeks has been changing very rapidly, particularly because of the Omicron variant that's out there, and we've talked about that in the past. But right now, what I want to focus on are the new CDC guidelines that just came out yesterday about what to do if you either have COVID-19 or you were exposed to someone who does have COVID-19, isolation versus quarantine, and how they have changed. Now, to go back in time, what we usually talked about was either 10 or 14-day isolation, 10 days, 14-day quarantine, isolation if you tested positive for coronavirus, quarantine if you're exposed to somebody who had COVID, especially if you were unvaccinated and started getting symptoms, which you needed to do. Well, they just changed all that yesterday. Now, even going back as little as last week, a little over a week ago, they had changed it for healthcare workers, HCWs as they call them. And the healthcare workers, what they essentially said were that you could go from 10 to 7 days for isolation if you test positive for COVID. And if you test negative at that point, you can go ahead and go back to work in the hospital, but you had to make sure that you wore proper masks and you did all the things you're supposed to do to keep you and the patient safe. Well, that caused a lot of consternation. There were some nurses unions that came up and said, wait a minute, this is going to be unsafe. We're going to be spreading infections to our, not only our coworkers, but patients as well. And that's the main thing we don't want to do. And so the concern was, is this causing a problem? Well, yesterday the CDC went one step further and they said, we're going to completely revamp this. And now we're going to make it that if you test positive for COVID-19, whether you're vaccinated or unvaccinated, they're bringing that isolation period down to 5 days, assuming you have no symptoms, assuming you're what we call asymptomatic. If you're asymptomatic, what they now say is 5 days of home isolation. After those 5 days, if you are asymptomatic, or if you end up having symptoms but they resolve by day 5, then you can go out and about in public for the next 5 days but need to wear a mask while you're out in public. And of course, if you start getting any kind of symptoms, go back into isolation, get tested, wait for symptoms to resolve, all those things. But again, the key is 5 days of isolation at home. If you have no symptoms, you're asymptomatic, then you can go out and about, but you have to wear a mask for the next 5 days. And as some experts are saying, this is putting it on the honor system. Now, what are the big differences here? Well, number one, they've reduced that down to 5 days, but how safe is that? And that's always been the biggest question. And I'm going to see if I can go ahead and screen share this here. But essentially what we're looking at is what happens when you get to that 5-day point with you, and are you able to spread it to other people? Well, they have a thing called PQT, which is post-quarantine transmission. And the residual post-quarantine transmission, the CDC looked at it just the 2nd of December. So this was 3 weeks ago, 3.5 weeks ago. And in their own data 3 weeks ago, here's what they came up with. If no testing was done, absolutely no testing was done, at day 10, your risk of spreading it to somebody else, your post-quarantine transmission risk, was 1.4%. So 1% barely. At 7 days, that rose up on the average, again, with no testing, if you're asymptomatic, to over 10%, 10.7%. So it went from 1.4 to 10.7%. And now what they're saying is, okay, well, let's look at this and let's look at it more in detail. Well, they're saying if you use testing, and particularly if you use PCR testing, but it goes from 0.3% at 10 days to 4% at 7 days. Risk still goes up. They even looked at antigen testing, which is at-home testing, and there it went from 1.1% at 10 days to 5.5%. And so the risk does go up as you shorten those days. And the concern with a lot of experts, especially those going back into the healthcare field, those on the front lines who are exposing themselves, who are basically potentially exposing the virus to other people if they do have it, is that they could be transmitting it there, and that risk does go high. But what the CDC also said, and Dr. Fauci mentioned this today, is they are essentially looking at what's the lowest risk with the greatest ability to get people back to work, to keep businesses going, to keep those frontline workers, those safety workers, those healthcare workers out there so they can do their jobs and keep the public safe. And I think that's what the CDC is looking at right now. But again, it gets very, very confusing because of what's going on. And now to make it even a little bit more confusing, what they did is they essentially broke it into two parts. One is isolation, and that's what we talked about. Regardless of vaccination status, if you test positive, 5 days of home isolation, followed by 5 days of if you're asymptomatic and never develop symptoms, or if your symptoms resolve at day 5, then you can go out for the next 5 days wearing a mask. But again, this is the honor system we're talking about, and we have seen in the past what happened when they dropped mask mandates, that even those that are unvaccinated took masks off, and that can cause the virus to spread, a lot of confusion as well. But then the confusion went in even more, and I'm going to read this specifically so I make sure that we both understand what's going on, because it can be very confusing when you look at their graphic. But what the CDC is saying, if you're exposed to someone with COVID-19 and you have to quarantine, there are 2 different categories. One category, if you have been boosted, or if you're fully vaccinated during that time period where you're not eligible for boosters yet. And by that they mean Pfizer and Pfizer, you're fully vaccinated and you're within that 6-month window where you can't get boosted yet. Or Johnson & Johnson, you got your Johnson & Johnson shot and it's less than 2 months old, so you can't get fully vaccinated, or you can't get the booster shot yet. Then what they say is you don't have to quarantine, but if you go out and about for the next 10 days, wear a mask and think about getting a test at day 5. But the second category is, and this is where it gets a bit confusing, if you're unvaccinated, or if you're fully vaccinated, eligible for the booster shot, but have not gotten the booster shot, so you're not boosted yet, even though you're eligible, and by that they mean Pfizer and Moderna, 6 months after getting the shot, Johnson & Johnson, 2 months after getting the 1 shot, then they say you fall into that same category as the unvaccinated, and they want you to stay home for 5 days, and then the next 5 days you can go out and about wearing a mask for the next 5 additional days. However, they also say if for some reason you can't quarantine for those 5 days, they want you to go ahead and go out for 10 days, but wearing a mask fully, and test on day 5 if possible. Of course, all these are predicated on if you start developing symptoms, if symptoms don't go away, you need to go ahead and go into isolation, get tested, and make sure that you don't have COVID. A lot of honor system here, a lot of relying on making sure that we walk that fine line between what's potentially risky for people out there and their potential for spreading it versus getting people back to business and back to work. If you look at the UK, and the UK is an example that a lot of people are using, and a lot of experts are saying, hey, why don't we follow what they do? What they have done is they have dropped their quarantine and isolation from 10 to 7 days. However, what they do is at 7 days, you have to take a COVID test at day 6 and day 7, a home test, and they both have to be negative. If they're both negative, then at day 7, you can go ahead and get released from quarantine. Again, testing at day 6 negative, testing at day 7 negative with home tests. Now, one big difference there, and I think this is one of the reasons the CDC has not included testing in their when to get out of isolation or when to get out of quarantine guidelines, is because testing is not as readily available here. If you notice around the country, people are talking about tests. They simply either can't find them at the pharmacies and the stores they used to go to, or the testing lines are so long that they're waiting hours and hours to get a COVID test. But in the UK, they have a system set up where people can get tests very readily, and they take tests on a very frequent basis. They can get tests from their National Health Service. They can get 7 of them sent to them on a regular basis. Plus, they can go to pharmacies, they can go to COVID testing sites, they can go to vaccination sites, and they can get tests there. And from what I understand, they literally just have them on the counters. You can walk up and get tests and go home and get tested. That's why they're able to incorporate testing there. Now, experts I've talked to said, if we could incorporate testing into the CDC guidelines, that would be very, very helpful. Now, time will tell where we go with this and what this does. We know we're going to get a surge in cases after the holidays. We know we're seeing a surge now after the Thanksgiving holiday. We're going to see another one in January after the Christmas, New Year holiday, and people getting together at that point. However, how high will that surge be? We don't know. The numbers right now are already much higher than we expect them to be, and because of the Omicron variant, will they go even higher? On the silver lining side of all this, if there is one, Omicron tends to be less severe symptoms, less hospitalizations, less people requiring oxygenation, ventilation, those types of things. However, we are hearing that it is hitting children harder in some areas. New York City, for example, has had a big increase in children being hospitalized. Other hospitals are saying they're seeing more cases, but the reason they think they're seeing more cases is because they're testing every child that comes in, regardless if they're coming in because they have appendicitis, a broken bone, can't breathe well, RSV. They're testing them all for COVID. The majority of those do not need oxygen, do not need ventilation, but we know Omicron is going to hit those that are more vulnerable, and those tend to be the children. So the bottom line to all this Essentially, the bottom line is get vaccinated, number one. When you're ready for the booster shot, when you're eligible for it, get the booster shot, number two. And that way you can fall into these isolation and quarantine guidelines where you can go ahead and get out as soon as possible and get back to work, get back to your job, or get back to the environment that you want to get out into instead of staying home because you're sick or potentially exposed to somebody who's sick. Now, they have not changed the criteria for what it means close contact. That is within 6 feet for 15 minutes or more a day of somebody who tests positive for COVID. That doesn't necessarily mean just one person. I could be around somebody for 7 minutes who's positive, and I get another phone call from somebody else, a coworker who I was around for 8 minutes. That's 15 minutes there, and so I qualify for that close contact within 6 feet for 15 minutes or more per 24-hour time period, and that puts me into these guidelines of do I need to isolate myself, and it depends, again, being boosted, being vaccinated, not being boosted, not being vaccinated, the two different guidelines. Can be very confusing. If you have questions, definitely go to the CDC site. They'll give you a lot more information, but hopefully this information helps out. And now again, looking forward here, we are seeing cases rise across the country. We're seeing cases rise across the world. One thing we are seeing in certain parts of the world is that there are cases rising, but the hospitalizations and deaths are not rising quite as much. Here in the US, we have not seen that yet. However, we think that is soon to come, and we're going to notice cases going up, but hospitalizations and deaths not going up, which would be fantastic. But at the same time, we can't rest on those laurels. We have to make sure that we are keeping everybody safe, particularly those who can't get the vaccinated under the age of 5, or the elderly who are possibly vaccinated, boosted, but still have immune system issues and aren't necessarily protected or as protected as we'd like them to be. And so overall, again, the message here is definitely make sure that you get the vaccines and booster when you can. Now, coming into the new year, I get a lot of questions about what can we do for New Year's? Can we celebrate New Year's safely? And the answer is you can, but you have to be very careful. Now, last year we were saying, don't do anything, stay home, keep everybody safe. This year we're saying, go ahead and go out there, but be safe and make sure you do it smartly. So in other words, if you're going to be in somebody's house, be in somebody's house who everyone's vaccinated, everyone has booster shots, people possibly tested negative right before then, and so you know that it's not going to be spreading through that environment. If you're going to a public venue, think twice about what the venue is, how many people are going to be there, whether there's going to be social distancing, mask wearing. You're not going to know the vaccination status or the booster status of everybody in that environment, so that's even riskier. And I always talk about these are different levels of risk. Staying home, obviously, with just your family, low risk. Going to a different place with other families, higher risk. Going to a public place, even higher. Going to a crowded public place is the highest risk, and those are the kind of things you want to avoid. So the name of the game is to go ahead and enjoy New Year's, but at the same time, try to stay as safe as possible. And that way you can get to 2022, where we hope this virus changes to the point where we've started to live with it, which is what we're seeing right now. And at the same time, we understand how to take care of it. But it's never going to go away, at least in our lifetime. So it is something we're going to have to learn to live with. And I think that's what 2022 will be all about, is figuring this out. But in the meanwhile, I hope you have a wonderful new year. Hope you have a wonderful time. And I hope you have a wonderful 2022. But I think we have some viewer questions, so let me see if we do.
How about testing a toddler with an at-home test? Are they accurate for that age group?
Yeah, so testing a toddler, are they accurate for that age group? They should be. These are not restricted to adults. These are children and adults, and it all depends on viral load. And so essentially, it's very interesting, and that's one of the reasons they did this, is because we know that 1 to 2 days before you develop symptoms, that's when you're the most contagious. Because what typically happens is the virus gets into your nose, it gets into your throat, and you don't have symptoms yet because it hasn't gotten into your lungs or into your body, and your immune system really hasn't kicked in yet. And so those virus particles, you can breathe them out, and that's when you're most contagious, that 1 to 2 day period. It works the same for toddlers, works the same for infants. We also know that 2 to 3 days after symptoms start, that's when the contagiousness starts going away. And so we think at that point that you're not as contagious as you were before. But for toddlers in particular, yes, you can use those at-home tests, and they should be accurate for them. You just want to be careful because their noses are much smaller. You don't want to put the swab back too far in there. And again, it's not very comfortable. We've all had these tests, and we know how uncomfortable they can be, and they're going to be equally, perhaps even more so for them, so just be careful. But again, we want to make sure that you understand that the guidelines have changed. The guidelines have changed for a very particular reason, trying to kind of walk that fine line between keeping people home, keeping the public safe, at the same time keeping the public going and keeping those emergency services and everything else going so we can keep people as safe and as productive as possible while keeping them as healthy as possible. Time will tell how well this goes and whether it changes or not. But in the meanwhile, again, like I said, hope you have a fantastic new year. Hope you have a wonderful New Year's Day. And I hope you enjoy 2022. Thank you.